So if you look at a condition where there's fluid accumulation that's occurring, in this case in the upper quadrant, then it is important that you have a game plan for minimizing the accumulation of that fluid because it plays havoc with your tissues in many ways. With most orthopedic problems, where there's swelling involved, it's just that temporarily your venous and your lymphatic system have been over-challenged by the fluid that is leaking out of your capillaries into the interstitial space. As you know, your heart pumps blood, and blood goes in the arteries. They keep getting smaller, they get down to the level of the capillaries. At the level of the capillaries, the fluid oozes out of the capillaries into the space between the cells, and that is the way the cells get their oxygen and food products in order to be healthy and to heal. And then 80 to 85% of that interstitial fluid should be picked up by your venous system and dropped directly back into your circulation. The other 15% of that fluid has to be picked up by your lymphatic system, and the purpose of the lymphatic system is to clean the fluid before it gets dumped back into your circulation. So your veins have small holes for the fluid to ooze back into, but the lymphatic system will have larger capillaries, larger gaps in their capillaries to allow debris and dead cells and garbage, essentially, to be taken up by the lymphatic system, and then it needs to be cleaned in your lymph nodes on the way back into your circulation. So if we think about draining the fluid out of her arm, we know that the fluid is going to drain right below the collarbone, and in this case the right upper quadrant is going to drain under the right collarbone. The entire rest of the body will drain underneath the left collarbone. And so we want to get her in a position where the fluid will run downhill in order to make it easy to move it along the path. So in this case, she's going to take her left hand and she's going to place it right underneath her right collarbone. And then she's going to compress the tissue between her hand and her rib cage, visualizing if there's a sponge on a counter, she would put pressure on the sponge, the fluid would ooze, and then she would let the pressure off long enough for new fluid to get into the sponge before she would compress it again. So it's not rapid fire, and it's not a pinpoint pressure. You want your hand to be over the whole sponge, so you're causing as much fluid exchange as possible with your compressions. You'll do about 5 compressions in order to clear the drain. And then she's going to ask her diaphragm to work in order to create a suction to try to encourage the fluid to be pulled out of the arm. And then she'll get her diaphragm to move by breathing in deeply through her nose. She'll feel that she breathes modestly, forcefully through her nose. She has to suck and her belly will move automatically. She'd like to have a nice volume exchange between breathing in. She doesn't have to strain at the end, but she wants as much volume exchange in her abdomen or thoracic cage as possible. When she breathes out, again, she doesn't need to strain at the bottom, but she would like to get as much air out as possible so there's as much pressure change as possible in order to move fluid from her arm towards the drain. So she'll take about 5 breaths. And then in the clinic, then the therapist would apply pressure in her arm in order to squeeze the fluid out of the deep tissue, and then they would do a stroking action, or you might see that we'll do this kind of funny little brushing of the skin, and the brushing of the skin is to cause these filaments that attach to the capillaries of the lymphatic vessels to open the gaps and make room for the fluid to get into the lymphatic system. So again, it will either be a pumping action or it will be this kind of quick sliding of the skin in order to get the capillaries to open. And we'll do that proximally, and then we'll move more distally. Same thing, we'll squeeze the deep tissue. That will cause the lymphatic fluid to move from the deep tissue above the superficial fascia, and then we'll move it along the path, either with a stroking action or with this quick brushing, all the way where the fluid has accumulated. At home, she won't be able to reach, so she's going to get this change in pressure with a muscle action. So once she has pumped the drain underneath the collarbone, has done the diaphragmatic breathing in order to suck the fluid out towards the drain, then she's going to tighten the muscles in her upper arm, and she'll let it relax. And she'll tighten the muscles in her upper arm so the muscle squeezes the fluid, changes the pressure. If the arm is positioned so it's higher than the heart, the fluid will have to go downhill. So she'll do 5 contractions of the upper body, and then she'll contract her wrist and forearm muscles by making a fist, letting it relax. She'll do 5 pumps, and then she's going to go back to the drain. She'll do 5 pumps with her left hand over the space just below the collarbone, 5 diaphragmatic breaths, 5 tightenings of the proximal muscles, 5 tightenings of the distal muscles, and she will repeat the process as much as she needs to in order to cause the fluid to leave her arm. It's important that you try to minimize the swelling, so the frequency of this is going to be determined by how long you can be up before the fluid will start to accumulate. And you just want to be a little bit proactive. As soon as it would start to accumulate, you want to drain it, because every time you allow the fluid to accumulate, it stretches the walls of the tissues become looser, easier for the fluid to accumulate the next time. The key is to keep the fluid out so the tissue becomes a little bit tauter. So it's like a stronger walls to the balloon, harder to blow air into the balloon as you go. You can get a compression garment for your upper extremity. And again, the purpose of the compression garment is to just add tension, so it's like a stronger walls to the balloon, so it's harder for you to blow air in the balloon, harder for the fluid to accumulate. They do buy you quite a bit of freedom, and with some stubborn cases it's necessary. It could be if you have swelling because of an orthopedic problem, but your lymphatic system is healthy. It just might be you need to do it long enough in order for the inflammatory process to run its course. And then you can go back to not worrying about it at all. It just depends on if you've let the walls get stretched and the fluid wants to accumulate. It is certainly in your best interest to keep the fluid from accumulating, because there's a cascade of negative events that occur when the fluid accumulates in your tissues. It will stretch the tissue, causing an abnormal distribution of mechanical forces up and down the chain. So you get tendinitises where you wouldn't have normally. It causes the communication between the synergistic muscles to be altered, so there's poor motor control, more tendinitises, more arthritis will occur. It causes the pain nerve endings to be stretched, so more discomfort. It causes as the fluid accumulates, then the proteins in the fluid aggregate together and become sticky, start to stick the connective tissue together, create a whole other issue for pain and for distribution of mechanical forces and motor function that will need to be addressed later. So it'll be in your best interest to minimize the swelling, to be very proactive about this, because it just is a price you got to pay for temporary swelling, but it will give you a shorter rehab, better recovery in the end.